but the strongest protection is with 2 doses of the vaccine. Since being designated a Delta hotspot in June, our vaccination rates have increased rapidly. For adults 18 and over, first dose coverage has increased from 58.6% to 79.6%. Second dose coverage has increased from 6.3% to 43%. This shows that our vaccine rollout is working as we continue to make it easier for residents to get a vaccine. There has been an incredible push by our community to rapidly accelerate our vaccine rollout, which would not have been possible without the support of our many partners and our community. Every staff and volunteer at a clinic, primary care providers and pharmacies, every person behind the scenes supporting planning and operations, finding new ways to work together to expand clinic capacity, to create new clinics, to implement new models, and to support first dose walk-ins anytime, anywhere. And last but not least, our residents who are getting vaccinated as soon as they can and who have come together in a remarkable way to help protect one another. Next slide, please. In closing, we are moving in the right direction. The additional 2 weeks in step 1 was a strategic decision to protect our community and to give us the best chance of continuing to move forward and not have to take a step back in our reopening steps. Our situation remains precarious, but we are moving in the right direction. We will continue to watch the trends, and I expect to be able to share more on step 2 later this week. Thank you.
Thank you, Dr. Wang. We will now turn to Deputy Chief Hilton for an update on the vaccine rollout task force. Welcome, Deputy.
Thank you, Chair Redman, and good afternoon. Vaccine rollout is working. Almost 70% of 18 plus residents have received at least 1 dose and 43% a second dose. Less than a week ago, 30% of adults 18 plus received a second dose. This week, we will reach 45% or more. We are committed to providing more opportunities for residents to receive first and second doses. As of July 1st, all the regional clinics, including pop-ups, began welcoming first dose walk-ins with no appointment necessary. And last Sunday, in partnership with Binghamton's, the Vaccine Distribution Task Force ran the first drive-through vaccination clinic, administering just about 1,200 doses that day. This was a very successful day, and I wish to thank everyone for stepping up to make this happen. This week, we are excited to partner with Bruce Power to bring the innovative Hockey Hub-style vaccination clinic to Waterloo region. This will allow for additional second dose appointments. The hub model allows the client to stay in one spot where the services come to them. Vaccine and recovery process happens while sitting in the same chair. Appointments open today and are now available for the soft launch of this model occurring on Thursday and Friday. These 2 days at Binghamton's will be the Moderna vaccine only, so no appointments for youth between the ages of 12 and 17. We will then launch a full operation at Binghamton's to continue with our Every Dose Counts event on Saturday, July 10th and Sunday, July 11th. Appointments will be available for this event beginning tomorrow. The weekend at Binghamton's will have both Moderna and Pfizer vaccines, so youth between 12 and 17. 12 and 17 can book at this clinic, in addition to the other clinics in the region offering Pfizer. Subject to any questions, that's my update.
Thank you, Deputy Hilton. I see a question already. Councillor Foxton.
Thank you, Madam Chair. And thank you, Dr. Wang and Deputy Hilton. So is it true that we're aiming for 20,000 doses on the July 10th and 11th?
Deputy Hilton?
Or did I misunderstand?
No, there's no misunderstanding. That is the goal, hoping for both the Saturday and Sunday to have this week 20,000 doses, yes.
So get out there, Waterloo region, make it happen. And now, Dr. Wang, I have to ask you, so I think down the road, we're going to move into step 2. We will still be out of step with the province. Is there any way that if our numbers remain good, if hospitalizations go down, if we are on the right track, do you think at some point it's possible we could move into step 3 along with the province?
Thank you for the question, Councillor Foxton. Yes, that is the goal. That has been the goal since the beginning, with the strategic temporary delay of movement into step 2, to give our community the best chance to move into step 2, as soon as we're able to, and then continue to move along with the province in the reopening phases thereafter.
Sounds like a Merry Christmas to me. Ladies and gentlemen of the public, please get vaccinated. 20,000 doses in a weekend. We need you to do it. Remember that it takes 2 weeks to take full effect. And let's get to stage 3. Come on, folks, rub those hands together, make it happen. Thank you.
Thank you for your enthusiasm, Councillor Foxton. I know you were there at the drive-through last weekend, which was very exciting. Just for those listening through live streaming or YouTube, my understanding is at the very beginning there was a bit of an audio problem. So Dr. Wang's slides, if you missed them, we can share them publicly, which have some important statistics on them. So our apologies for that. Councillor McGarry.
Thank you, and I certainly share Councillor Foxton's enthusiasm at getting people out to vaccinate, because that's really the only thing that will prevent us from getting ill or to backtrack. Dr. Wang, I do appreciate the fact that we've certainly seen an uptake in not only the first dose, but also the second dose vaccines. We understand why you felt that we needed another 2 weeks to sort of get control of this Delta variant. The story for me that is still concerning is the news about our hospitalization rates. That means our critical care units are still almost in an overwhelmed state, and that potentially other people needing critical care, whether it's a trauma or a cardiac case, may be shipped out of region in order to find the appropriate care. Could you please just give a quick update about our hospital rate? Because I think the public doesn't understand when they see the numbers that the correlating issue is our indicators in our healthcare system.
Yes, thank you, Councillor McGarry. Yes, our hospitals continue to be under pressure. They continue to experience hospitalization rates that were as high as they were when we were in the third wave. This is what you can see with Delta. I can see rapid spread, and you can see more aggressive illness. And so really, when I made the decision to temporarily delay Waterloo Region from moving into step 2, it was really taking into account the overall risk in our community, so that we could have a little bit more time to stabilize some of these rates, and importantly, get our community vaccination rates up as quickly as possible, in order that our case rates may start to trend downwards. And usually what happens is the hospitalization rates, the outbreaks, those kinds of things will lag behind the case rates, and will also tend to follow the case rates. And so it's a very good point that you make, because I think, it wasn't necessarily very clear to a lot of people that that surge in Delta and the fact that we still have Delta circulating today, and it's still significant in terms of circulation. It does translate into increased pressure for hospitals, which recently translated into our own local residents having to be moved out of region to receive care, as well as procedures that had to be further delayed for other residents because of the pressure that the hospitals were under. So it is certainly part of the overall picture in terms of the decision making about step 1 and step 2, but really overall it's to have the best chance to control the situation so that we can move into step 2 when we move into step 2 and continue to move forward in our reopening and not have to take a step back.
Councillor McGarry?
Yeah, thank you, Madam Chair. And Dr. Wang, I'm still in contact with many of my former colleagues who continue to work in critical care units at all 3 of our urban hospitals. And I know they've been extremely concerned and have reached out to me to say so many people are telling us to reopen because the numbers are down. They don't feel this. They're still working a lot of overtime, are exhausted, and continue to see the surge in patients in their ICUs. Do you have anything of hope or any message for them at this point? Thank you.
No, thanks for that question, Councillor McGarry. They are working incredibly hard. Like you said, they have not stopped. They have been dealing with all the impacts that most people don't see behind the scenes when they just look at the case numbers. They're dealing with real people, real families, and oftentimes, as you know, Mayor McGarry, because of your experience and expertise in healthcare, these are patients that often take a while to get better. So even if they no longer count in the hospitalization numbers because they're no longer considered infectious, they often stay in hospital for long periods of time, and they can have very serious illness. And so, the hospital acute care and all our healthcare system partners, including the ones that continue to support congregate care homes that are in outbreak with intense supports, have not stopped working incredibly hard. And I know that they're very, very tired. And they often, want people to know that the best gift we can all give them as healthcare providers is to do everything we can to stop or slow the spread of COVID. That would really make them happy.
Thank you. Councillor Vrbanovic, please go ahead.
Thank you very much, and thank you, Dr. Wang and Deputy Chief Hilton for your updates and your continued work in both of your respective areas of responsibility. Dr. Wang certainly was, very encouraged by what you included in your update today in terms of the vaccination rollout. And for those who maybe weren't able to hear, since the designation of the Delta hotspot, we've seen basically another 20% of adults over 18 get their first dose, and about 35% of adults over 18 get their second dose.
That's correct.
And I know that's something that you've talked about. The fact that we were lagging the rest of the province because other areas that were Delta hotspots before us were prioritized. So is this the kind of growth that you were hoping for?
Yes.
And does it have us moving in the direction that we need to as quickly as we need to?
Yes, it's the progress is very good. As you mentioned, other hotspots did get significantly more vaccine in May, which allowed them to move up their rates earlier, and their rates will continue to be, you know, a little bit ahead of ours due to the fact that you know, they had a head start. But we are rapidly increasing our rates here. The progress has been very good, and we need to build on that momentum in order to, again, not only, you know, allow us to move into to step 2, which we're on a good path towards, but to really protect our community as much as possible, and allow us to, you know, move into step 3 in alignment with the province. And not only that, but I'm looking ahead, right? Delta is a very significant threat right now, but the nature of viruses is to, you know, create variants. And so having as high as possible a community immunization rate will best protect us, not only against Delta, but against other variants that will come along. And we do see both the effect of Delta, how explosive and devastating the growth can be, how sometimes jurisdictions have to take a step back. But we've also seen when jurisdictions have had high rates of vaccine coverage, how effective it can be at slowing Delta and bringing it under control. So we want to be in the best position that we can be throughout the entire summer, accelerating as much as we can, you know, our vaccination coverage. And you know, I would like to kind of second what Councillor Foxton asked the community. You know, we're doing it. We're really coming together. We're increasing our vaccination rates at a rapid pace. Let's continue to do that, and that's going to best protect us step 3 and beyond as well.
That's great, and that's encouraging. You know, I was just reading earlier today the story of an author in the States who writes about equality and diversity, compassion, love, and so on. A gentleman by the name of John Pavlovitz, and well regarded in his writings. And his he was writing about his family, actually. You know, 3 of them have been fully vaccinated, double vaccinated, except for their child under 12. And they went on a vacation, and he was just talking about, you know, how as careful as they are, you know, you start naturally letting your guard down a little bit. Their 11-year-old ended up getting the Delta variant, and then lo and behold, all of them got it, even though they were double vaccinated, but of course weren't gravely ill, and was touting the importance. And so I'm wondering if you could just touch on that a little bit as we go forward, just reminding people that, you know, yes, we can start enjoying the summer and doing things as we, you know, potentially from phase 1 into 2 and then 3 down the road. But that still means we need to practice good public health guidelines for the foreseeable future.
That's an excellent point, Councillor Vic. Thank you for raising it. Yes, we are learning lessons from other jurisdictions which have seen Delta surges earlier than us. And one of the most important lessons is that if you let up on public health restrictions too quickly, you know, you go too quickly into reopening, you let up on the need to mask or physically distance, you will see surges. And that's why it's really important. It's great news that our community is becoming more and more protected every day. But until we have very high rates of coverage across all parts of our community, right, across all neighborhoods, high rates of people having had 2 vaccines, as well as low rates of community circulation of COVID-19, we have to maintain a lot of diligence with our public health measures. and you know, especially in settings where we're around those that, you know, are not in our household. So you know, that's part of the reason that you know, Ontario is moving into its various stages, one step at a time, because we are seeing what's happening elsewhere in the world when it doesn't when it's not as phased an approach, and it's a incredibly important message, Councillor Vrbanovic. Thank you for raising it. We need to keep up with our public health precautions as well.
Okay, two more questions. Just as a follow-up to that one, what is the status of testing on vaccine for people younger than 12?
It's undergoing clinical trials, and we hope to, you know, hear good news about vaccines being approved for that age group. Right now, I think we'd be looking at September and October as the time frame when we'd be hearing that news. You know, of course, the plan would be to begin immunizations in those younger age groups as soon as we have approval to do so.
Okay, that's certainly encouraging to hear, because I know that's causing certainly a lot of questions, particularly for parents who have younger children and, you know, wondering what the fall might look like in terms of school. My last question is really for you and or Deputy Chief Hilton, and it's looking at our numbers. And you know, I was listening to the provincial MOH earlier today, and he was giving a shout out to our region for how quickly we, you know, once vaccine was made available, how quickly we responded. And in fact, on the weekend, I think 10 minutes passed when we added 300 spots at the Binghamton drive-through before they were filled up, which was pretty awesome to see. You know, we've reached 80% almost in terms of our adults 18 and over, but there's still 20% to target there. You know, and I know we're coming up with some innovative ideas. You know, I think Deputy Chief Hilton's hoping to post a hat trick maybe in the coming days in hockey lingo. But I'm just wondering, you know, how do we think we can, like, as challenging as this has been for so many people, and I really wanted to say thank you to, you know, as much as we want to acknowledge all those in the healthcare, you know, who have done yo-person service over the past 16 months. We also want to acknowledge all those who have struggled on the other end in terms of closed businesses and inability to work, and the impact that all this has had on them. How do we now sort of try to turn this around and shoot to maybe become the best vaccinated community in the province going forward? Do we have any thoughts on and creative ideas on how we might continue doing that?
So who wants to take that, Dr. Wang or Deputy Hilton? Why don't you weigh in with some of our crazy ideas?
Certainly, I can jump in. I mean, when we start to look at Every Dose Counts campaign, bringing vaccine into our priority populations as well. I think we've been really innovative in terms of, you know, providing a lot of clinics, but then I think just with this past July 1st, encouraging those that perhaps might have been sitting on the fence around whether they should get a first dose, making it available without an appointment, because sometimes that can be the barrier to getting the vaccine as well. So all first doses for sure are at our clinics. are definitely a priority where no appointments are necessary. With the drive-through clinic, as you had mentioned and also had observed, the amount of people who arrived looking for first and second doses. And then now with the hockey hub model, just trying to bring different ideas and looking at different locations to ensure that we are eliminating some of the barriers for people who might not have the accessibility to some of the clinics as well. The team is amazing. The team keeps creating new ideas. I think it's also looking at the availability, but the encouragement of the community, and then also seeing others who will step up and, whether it be through social media and other platforms, encourage and share their own experiences as to their why for the vaccine. So it's certainly something the team is always working on to encourage people to, it's never too late for the first dose, and then to continue to book for appointments on second doses. I look forward to the time when we don't have to book appointments and people are walking into these clinics for their second doses as well. So we're moving fast, and the uptake, there's still the demand. So right now we're not seeing the hesitancy, so to speak. We're seeing the demand and keeping up with the demand.
That's fantastic. And one of the things, just while you were speaking, that I was thinking of, we're fortunate in this area to have 3 well-used farmers markets in Cambridge and in St. Jacobs and in Kitchener. It may be worthwhile. It's one of the few places where large numbers of people still gather on Saturdays in safe ways over the course of 8 hours. And it may be something to think about as a way of attracting maybe audiences we aren't getting otherwise. So I'll leave that with you to talk about with the group.
Thank you, Councillor Vrbanovic. Dr. Wang, did you want to add anything to Deputy Hilton? Okay. Councillor Galloway.
Well, thank you, Madam Chair. The first question I have is the Deputy Hilton, you mentioned the hockey hub model, which I think is really exciting and is going to prove its value Thursday and Friday at Binghamton. And then you mentioned Saturday and Sunday at Binghamton's as well. Every dose counts. So the 2 questions I have is, I understand Thursday and Friday is pretty much a Moderna clinic, and then there'll be both available on Saturday and Sunday, if I have it correctly. But are all 4 days the hockey hub model, or will they be different on Saturday and Sunday?
Deputy Hilton?
Thank you for the question. The hockey hub model will be Thursday, Friday, and then we'll have a blended approach on Saturday and Sunday, where we will use the hockey hub and use a traditional model. So people will be moving throughout the hall there using both models.
Okay. The other question I had, or maybe it's just information that can be repeated for the sake of anybody watching in the media, there might be some concern that it's a Moderna only clinic on Thursday and Friday, but we now know that the mixing of the vaccines is perfectly acceptable. Maybe Dr. Wang could talk about that, so that people don't get the impression, well, I can't go Thursday and Friday because I need to wait for a Pfizer.
Yeah, for sure. So I would say Canada, Ontario, Waterloo region are all incredibly fortunate that we have got a lot of Moderna. The supplies of Pfizer have slowed down this month, but we got a lot of Moderna to compensate. Moderna and Pfizer are the 2 best vaccines in the world. They are both highly effective. and they have the same technology. They use the same mechanism of action. They have the same efficacy. They have the same side effect profile. They are like twins. That's how I like to describe them. And they are perfectly safe to interchange. And I highly recommend that people do not wait to receive an mRNA vaccine just because they want to wait for a certain brand. That they get the first mRNA vaccine that's available to them. And, you know, studies are continuing to come out that continue to reinforce the efficacy and the strength of the Moderna vaccine in providing protection against not only COVID, but the Delta variant as well. And how strong it is, how effective it is, and how it's essentially the same in terms of efficacy as Pfizer is. And so I strongly recommend that people take the first mRNA vaccine that's available to them. And a mixed series, more and more of our community is completing their series with a mixed series, and it's safe, it's effective, and it's highly recommended. Basically, what I'm recommending is that people complete their series as soon as they can. That's going to be the best way to protect them and their loved ones.
And Councillor Galloway, just to clarify, Thursday and Friday are Moderna, and when there is Moderna and Pfizer on Saturday and Sunday, the Pfizer is actually for the 12 to 17-year-old group, because that's the vaccine that was tested and approved for that age group. So everybody else will be getting Moderna, just so people aren't sort of looking at vaccine shopping.
That's important. Thanks for that, Chair Redman. The other question, my observation at Sunday's drive-through clinic was that there were a lot of elderly parents or grandparents that were driven through the drive-through, and possibly, you know, some mobility issues in that. Are we thinking of doing a drive-through again, or was that a one-off?
Deputy Hilton?
Nothing is ever off the table in terms of what the planning is. And as you know, the planning changes weekly as well. It really just depends on, and again, it depends on staffing. It depends on what other clinics we might be running as well. But that is not off the table. I can't say that we have one planned immediately with this event occurring this weekend. In addition to, and I think what's really important as well is in addition to all the other clinics that are still running, we do speak about, you know, the hockey hub and working with our partners, but we still have our other regional clinics running. We have primary care offering appointments through the week, and we also have our pharmacies who are 7 days a week offering appointments as well. So I think, you know, it's looking at how we can staff all of the things and clinics that we are trying to plan as well. So it's balancing it all at once.
Okay, thank you, Madam Chair.
Thank you, Councillor Galloway. Councillor, please go ahead.
Thank you, Madam Chair. You know, with Deputy Hilton's enthusiasm for the what she's forecast this weekend, I think the Montreal Canadiens should be flying her to Tampa Bay tomorrow and get her behind the bench for the game. Go for it, Shirley, go for it. You know, I think the tremendous response to the first and second doses following our delayed entry into stage 2 confirms the strategic decision made by Dr. Wang and public health. And it was right to minimize this aggressive spread of the Delta variant. And, you know, it's interesting to note that in the last 2 days, we're hearing about the spread of this variant in a number of states in the United States and in Europe. And so it just goes to emphasize how proactive we have to be at trying to control the Delta variant in our community. And I think, to me, confirms the actions that were taken to delay going into stage 2 and encourage everybody in our community to please take this seriously as a significant healthcare issue and get that second dose and get that first dose, and encourage your neighbors and your families and all of those that you care and love about and love to do the same thing. We need to do this to have a safe and healthy community and an enjoyable summer for everyone.
Thank you, Councillor Urban. And I know that Dr. Wang does not like to brag, but anyone who saw the Provincial Medical Officer of Health, Dr. Moore, I believe, talk about what's happening in Waterloo region, he gave us a shout out, not only for getting vaccines in arms and reacting really quickly when we had the supply, but also helping to protect the rest of the province, because we know Delta is other places. We know it will continue to spread, and what everybody can do, what is in their control, is to go and get their first and second shots. So thank you, Councillor Erb. That was a really eloquent public service announcement. I see no further questions. Dr. Wang and Dr. Hilton. I keep making you a doctor, don't I, Shirley? Sorry. We are in your debt, our whole community is. So thank you for all the hard work you do, the legion of people who are behind you, and a shout out to Vicki Murray, who has been nothing short of amazing. And stay tuned for what we hope is more good news for the rest of the week. And I will now entertain a motion to adjourn. Moved by Councillor Jaworski, seconded by Councillor Jowett. All those in favor, or please use your icons. I guess you could vote against it, but nobody's going to, are they? Thank you, colleagues. Everyone stay safe and have a great evening.
As always, safe drive home.